Hello, my name is McKenna Patterson, and today I'm going to be talking to you about the technology behind interactive metronome therapy. So just a very brief recap, in case this is the first part of the website you are seeing. Interactive metronome therapy is a form of therapy that uses feedback as a training assessment tool for its desired outcome. There is 5 components of interactive metronome therapy. The first is the main station that connects to the computer, headphones for auditory feedback, one or more triggering devices, whether that be a tap mat or a hand sensor, IM Universe software, and a computer. So going back to the IM station, or the main station that connects to your computer, is it connects to any Mac or PC laptop computer through USB. And what it does is it calculates real-time measurement down to the millisecond in coordination with the triggering devices. It syncs the training to a cloud for easy access and allows for the system to record everything as it's going on. Triggering devices connect with the main station wirelessly or through a wire, just depending on what kind of technology may be accessible to the client at that time. And when the client performs the exercise that corresponds with the triggering device to the beat, which we will talk about in just a moment, it registers down to the millisecond that action. So for example, if you were clapping, you would have a hand sensor on. Every single time that you clap your hands together, it would sense down to the millisecond how close to the beat that you were. The headphones for auditory feedback are placed over the ears, and they have specific right and left side placements that are typically labeled by the individual themselves once they receive them, but they do contain very small lettering on the side when you receive the headphones. To get the auditory feedback, certain noises are played in correspondence if you need to speed up or slow down to get onto the beat. The beat is already preset at a specific rate depending on what program you choose or what program your provider chooses for you. And the headphones will give feedback on how close to the beat that you are. So for example, some programs will have noises in the right ear that mean to speed up or speed up a lot. And the left ear may mean slow down or slow down a lot, just depending on the program and the provider. The IM Universe software contains different animated games and different types of programming that may appeal to all age ranges. If an individual decides not to go through a provider, they can still download and receive an IM package, which would allow you to do these exercises at home using a gaming system. These games consist of 14 different genres, and they are all in coordination with the typical IM therapy. They're just presented as a game rather than a therapy component. Other software includes the clinic integration, which allows client training to be synced with clients and programs to be adjusted. This would be best for office care. So if someone does this therapy in an occupational setting or in a psychological office, this would be what is best. Last but not least, everything has to do with a computer. So you must have a coordinated computer that is able to run the system in any way. So how it works, I kind of talked a little bit about how there are different gaming systems, but we are going to mainly focus on IM therapy in a more therapeutic setting. So exercises can range from clapping, tapping the foot, bouncing the hand off the sides. There is also things such as coordinating one tap off the side with one tap on the opposing foot every single time. And the goal is to synchronize these movements to a beat using the sensors at hand. So we talked a little bit about the hand sensor. There's also a foot sensor in there. As you can see, it's called a tap mat. And what the tap mat is you can use your foot to actually tap a flat mat on the floor. And what it does, it'll send feedback down to the millisecond, just like the hand sensor, on if you are on beat or not. The feedback. So as you perform the action, you'll get instant feedback through the headphones and the screen. The screen may be an accommodation to those who are audio impaired or those that don't prefer to wear headphones for sensory issues, or those that just do not hear that well or don't like the headphone feedback at all. The visual feedback is done through color coordination and will vary depending on what setting that you do it in. Like I already said, one noise means you're performing the action too fast or too fast, need to slow down, and one noise means that you're performing the action too slow and need to speed it up, just as one color would mean that you're performing it too fast, need to slow down, and the other color would mean that you're performing the action too slow, need to speed up. Last, there's a positive noise, so it's a positive reinforcement noise if you are on the beat exactly, just like there is a positive color if you are doing the visual feedback option. The goal of the therapy is to get your score as low as possible. Score is counted by the number of times you are not right on the beat. So, for example, if you get feedback, it'll count as a score. If you get no feedback other than the positive reinforcement sound, you're doing great, then it will not count as score. Typically, scores start in the hundreds and move down to 20 over the progression of time, just depending on what program you do decide to do. But in a basis census of generalizability, it starts well into the hundreds and down to about 20 is usually when a therapy program will say that you have graduated. The nice thing about IM therapy is if you ever feel like the effects are wearing off, you can always redo the program. There is no limit to how long you should be doing the program. It's very individualized for any specific reason, and you can always repeat the therapy. There is nothing wrong with that. I already mentioned that there is a accommodation for those who are hard of hearing or do not like the audio feedback. But varying exercises are provided to best accommodate all skill levels. I talked a little bit about clapping and tapping the foot. If you can't clap for some reason, say someone is an amputee and they do not have one arm, they may just focus on bouncing their opposing arm off of their hip and doing feet exercises, whereas if an individual cannot